presentation. Now we have our next speaker, Dr. Hegde Sharat, on talk Artificial Intelligence in Retina.
Thank you, Ace, for this thing. After the chat GPT has come, now everything, the presentations and everything which is doing, in the future days, it will happen like the patient will just tell them, type the message or something will come where artificial intelligence will try to get the what is the diagnosis and all. I don't know when the artificial intelligence is going to do surgeries and this part of it. So let me touch about you what is artificial intelligence and how it is using helpful nowadays in the retinal department. So, what is mainly an AI? It is a study of the computer where it is trying to attempt and to put a model where it is thinking like a human mind. So, it is a hardware or a software which has the capacity of being intelligent. So, for example, if you see this image, a normal computer can't distinguish whether there is a cat or there is behind there is a clock or anything. If the computer is able to distinguish this is a cat, what you are seeing, this is a clock, what it is there, then it is called as artificial intelligence. So, and it has a various groups, subgroups which are there nowadays. Very much running around nowadays. What we use is deep learning and something called as convolutional neural networks. So this is like you can compare these convolutional neural networks with our brain, where they have in the neurons they have a lot of connections which are there, multiple connections. Like that, there will be like multiple internodes will be there, which will help us to classify it based on divide, and to come into a diagnosis. So here you can able to see this first image is a classic machine learning where only 2 or 3 neurons will be there, and it will give the output whether there is a disease, whether the diabetic retinopathy is there or not. And the second thing what you're seeing is deep learning, where one network which is there and it will be having multiple nodes and it will give a diagnosis. And in the deep learning you don't want to give any inputs. Previously you can able to see in the classic learning, previously some doctor has to sit or some person has to give feed the data saying this is the condition and all, but in the deep learning that also is not required. So like artificial intelligence nowadays is used in many applications. Like if you search anything in the Google the next day, or if you search anything in the Amazon the next day, whatever you search it will come that only. Similarly, any advertisement in Facebook, if you see any videos, the next videos what they come will be similar to the what videos you have seen. That is the intelligence which nowadays they are using there. And if auto driving also, Tesla and all, which they left like driverless driving, that is also one of the artificial intelligence. So how, when you come to health, how it is helping? So the main thing is required is the data, and lot of data wherever it is there, it helps a lot. So first and most important, radiology, where you get CT, MRI, X-ray and all. And as in ophthalmology, you have a lot of data where you take fundus photo, OCT, similarly cornea slit lamp imaging and all. So there are like various data sets now are there in the ophthalmology, like Kaggle, the IPAX, Mesidor, where they have a multiple like I can say 10,000s of lakh of images which are there, which are kept ready so that you can help it to diagnosis. So Retina, as I told you, it has a lot of opportunity for the AI to come, because we have fundus photos, we have OCT angio, B scan, where we have a lot of images and we can use it as a data. So there are mainly 3 types of classification what we see. First one is called as where we use this is classification, where we divide the condition whether the diabetic retinopathy, for example, whether it's there or not there. Segmentation means in the diabetic retinopathy whether there is any hemorrhage or is it a hard exudates. To divide like that, it will be helping. Prediction means, for example, today the patient has mild NPDR. So what will happen in the next 2 years or the next 5 years, whether the patient is going to moderate NPDR or PDR based on the various factors which helps is called prediction. So just most important thing where AI is working now in Retina is artificial in diabetic retinopathy screening. So it has become a main focus here. So as all over the world, the diabetes is increasing. Similarly, the amount of doctors where to screen is less. So this helps us to screen whether the diabetic retinopathy or something we say it as referable diabetic retinopathy is there or not. So there are like various studies which has come, and already FDA has approved 2 or 3 softwares for that. One is the IDXDR, which is the first FDA approved one, which helps for the diagnosis, and yes, Google also has it. So this is just a screen flow process where I am showing it. So initially what they do, a trained person or ophthalmologist will go and take a photograph, and this photograph will be uploaded, and the artificial intelligence, what it can do, it can see whether the patient is having a diabetic retinopathy which has to be referred and required, or there is no DR changes. And you can also keep in the middle, you can if there are some diabetic retinopathy changes, you can send it to a doctor where he will see further and he says yes, the patient has to be referred and he requires treatment. So this is the one more app nowadays where in the mobile only you can upload the photograph and you can say whether there is a diabetic retinopathy is there or not. So like various studies have come nowadays where it shows yes, artificial intelligence is helping a lot, like IDX, Retmarker, Google, IAT, lot of softwares are coming now. So this is the one of the study where I have done, where we have tried, I have annotated more than 40,000 images, and we have seen that using a smartphone in the mobile, if somebody uploads, how is the predictability, whether is it, how much is the sensitivity and specificity, and we have seen almost 90 to 91% of sensitivity and specificity of diagnosing DR. So also, as I told you, it also helps in the segmentation where we can able to see what is, whether the patient has drusen, whether it's a hard exudates or a blood spot. So saying it can be different condition, it can be DR, it can be ARMD and all. And Google also has come that saying by you seeing the retina, one can also say whether there is an heart attack or the Alzheimer's disease and or not. So there are like various articles have come. Coming to DME, yes, it is also trying to segment OCT and fundus photo where they mix together and they see whether the DME is there or not, whether it has to be referred or not. So the various classifications have come on that. So this is the one study which is showing that the DME can helps us to differentiate the retinal conditions, whether it's ARMD or DME or anything. And one more important nowadays is coming in the retinopathy of prematurity, where IROP, which is the study which has been done, and it has shown it has a very good sensitivity and specificity. So this is just a one or two articles which is showing it has a very good sensitivity and specificity for the detection of the ROP, so that it can be referred immediately. Yes, in ARMD also there are like nowadays there are like various studies which has come and which is dividing whether patient has ARMD or wet or dry AMD. So I'll just finish. I'll just come to the conclusion as time is this thing. So yes, there are some benefits which are there. It has a faster screening and diagnosis. It has a more accurate detection of early signs of diabetic retinopathy. It has increased access to the screening in the underlying population, and it is most cost effective compared to the traditional screening. But there are also certain limitations because it's not perfect. Still, it has to refine a lot because there are some black box issues where it can say this is a different condition at all. And still, the algorithms which are there has to be improved a lot because it's everything what we put the image it is. Similarly, the image clarity also should be good. So if the patient has a lot of cataract and all, it becomes very difficult. It may give a wrong reading. And there is a risk of doctors to become addicted to this condition and they may lose their diagnostic abilities. Thank you.
Any questions from the audience regarding this topic? Doctor, when do you really see this transforming into real life, seeing this technology in our clinics, in our day-to-day practice, and how far
So
down the line
nowadays
do
a
you
lot
see?
of already it has come into a daily practice. One thing, screening it has to come. Few of the centers they are doing the screening also using this. Where in the mobile van clinic they are trying us. But if you see in the OCT angio and OCT, so that image clarity segmentation and the image clarity, because OCT angio has a lot of artifacts, so it helps us to remove the artifacts and it gives a very nice image. So it's already there in our regular life, but yes, it has to still, maybe it will take another 5-10 years to come into the practice properly.
Excuse me, sir. Like, do you have any experience with automated machine learning, with those platforms where you can, even like without codes, if you want to,
Without?
without coding, if you have no knowledge in coding,
Yeah.
there are platforms which are available. So any experience with that?
See, there are certain codings are ready-made available nowadays. You no need to make a coding, because like a GitHub and all which are there. They have a lot of codings which are there, but they give only a basics. For example, in a Kaggle, they did a competition on diabetic retinopathy, and they have almost 10,000, more than 10,000 codings which are available to see the sensitivity and specificity. You can directly use them. And nowadays we have something called as preset training data.
There is also transfer learning. So, like, can
Yeah,
you use that?
transfer learning, what you said, preset training data, you can use that, and you can apply to this condition, and you can see that. That's the advantage now what you are having with the what you said, like preset data training. Yeah.
Thank you, Doctor.
Yeah, one Dr. Hegde, Dr. Sharat, I just wanted to ask you which software you are using for this artificial intelligence.
Means,
Which software or which artificial
so
intelligence?
no, actually what you are using now, non-mutating fundus cameras which are there, for Zeiss have their own software. Visual Scout 100, they have their own software. Remedio has their own software.
Right.
I don't use, miss, I was when I was annotating the images, that time we were using that something called as there's a different web form which is there. Yeah.
Use it on any user interface that you have. But if you want to do an annotation or if you want to analyze the data and allow them, you want to code it.
No,
Code will be
considering
done
the
in the Python or
sensitivity-
any other software.
Considering the sensitivity and specificity of all this software, which one is found to be better?
Depends on the coding system that has been utilized to develop the program. So at the end of the day, AI itself is a software that you install on a computer. So what Retina was asking, has it been used in physics? The government of New South Wales, where screening is usually done by optometrists. So they have acquired the software that we are developing pilot. So that is a pilot project there where optometrists will then this will analyze and only refer those patients who require examination.
Okay.
So the current methods are that if you are able to say whether this is referable or not, that saves a lot of travel and decision time.
I think they have published a paper also on that. Yeah.
Okay. Thank you.